I'll now introduce my next speaker. Our next speaker, Dr. Lisa Te Morenga, also from the University of Otago in Dunedin, who's going to be talking to us about mHealth.
So, ngā mihi kia koutou, I tēnei wā, ko Lisa Te Morenga, taku ingoa. Thank you for having me here today. So I'm much more used to these days talking about sugar, but my kaumātua Jim had that role last night, and I'm talking about something that I've really got into very recently as a result of being a part of the Healthier Lives National Science Challenge. And so I'm going to be talking about a really exciting project that I'm working with Cleona and Toi Tangata and a bunch of other organisations all represented here, looking at mHealth for diabetes and obesity prevention in Maori and Pacific communities. So just to start off with, in case you don't know, mHealth is a term used to refer to the use of mobile technology, mobile tools to deliver medical and public health services or practice to consumers. And this is a definition that was created by the World Health Organization group, I think about 2006. And it really describes, I think, how quickly this whole area is moving on, because it mentions personal digital assistants here, PDAs, and I don't think they're even used anymore. The smartphone in that time has become ubiquitous, probably. I wanted to put a little bit of data here just to make sure to convince you that our Maori and Pacific communities are going to be appropriate targets for mHealth interventions. And this is some work also getting quite out of date from Te Puni Kōkiri 2008-09, which looked at the use of e-media in New Zealand by Māori compared with non-Māori. And you can see here that Māori actually are probably at that time were even higher users of e-media than our total population. I couldn't find any equivalent information for Pacific people. There's a lot less research done, but I believe it's probably similar, but perhaps a little less, slightly lower uptakes of e-media. And you can see on this chart here, it's hard to read, but social media was kind of the most important use or most predominant use of e-media by our Māori whānau. And I certainly know from my own whānau that pretty much all my aunties and uncles and cousins are on Facebook, and that's how we keep in touch with each other these days. Keep our fires burning te ahika. And just a little graph here from the same survey looking at mobile phone use here, and again you can see that mobile phone use was really high in our Māori population. The nice dark blue bars here compared to non-Māori here, so actually slightly higher usage pretty much across all those categories of the sorts of things people do with smartphones or mobile technologies. So I'll move on past that one. On to our absolutely cool project. We've called it Ola Ora. It's a very name that came out of our partnership approach. It's a 4-year program aiming to design and evaluate a culturally tailored, personalised mHealth lifestyle support program for Māori and Pacifica communities, and it's using a participatory co-design process. Now this morning, Minister Goldsmith talked about how we as scientists, we know, and researchers, we know what solutions, what things we need to do, but it's just a matter of getting the public to do those very simple things. And I think it's easy to forget in that conversation that our communities themselves have a lot of knowledge about what works for them, and we shouldn't forget them in these conversations. And so the kaupapa of our program, Ora Ora, is to bring the community into a real partnership with us where their views have just as much validity and relevance as our sciencey views and our health promoter views here. Because unless we really understand what it is the public or community thinks will work for them, I don't think we're going to have any real success. We live in an ivory tower, really, of people like us, and so it's very hard to say what would work for the lay public out there. So I didn't really want to claim this talk as my own because it is very participatory, and so I wanted to acknowledge most of the people that are involved in this project. And you can see we've got scientists like myself and Cleona and Riz Firestone from Massey University co-leading this project, but we've got community partners from Toi Tangata, the South Waikato Community Trust, I think the Whono in Auckland, and the Waifetu community in Wellington, and also Te Haoranga from Ngāti Whātua, and these are some of our people here. I also wanted to acknowledge Leonie Mātoi here, who was very instrumental at the start of this project at helping us to build some really strong community groups, and she's now moved on from Toi Tangata but has left us in the very capable hands of Kelly Corrigan. Where are you, Kelly? Oh, she's not here. Oh, she's there, sorry, invisible down the front, who has taken charge and doing a fabulous role at keeping that relationship working for us. So how we started, which came very much from Leonie, was making sure that we got to know each other, whakawhanaungatanga. So our research team, our community teams, and our community research assistants spent quite a lot of time really establishing who we were and what our shared values were, and before we even got round to doing the work. And we came up with a range of common values here, which we try to hark back to the whole time to make sure that we're really giving, that our process has real integrity. Leonie also introduced us to this fabulous crazy person here, which is Rangi Marie Mules, who is a real enthusiast for co-design, and we also spent a lot of time learning about the co-design process. So she taught us as the researchers, she taught our community research assistants, and they were able to translate this idea about co-design processes for tricky solutions to the community. And she had spent time at the Stanford Design School and has brought these ideas through to us. But our processes sort of followed this pathway where at the start we've really got to know who our community is, empathising with them, trying to hear what it is they think they might need. They're telling us what they think they might need, defining the real the solutions or the real questions that they want addressed, coming up, ideating ideas that might meet those needs, and then building some prototype solutions and going through a very iterative back and forth process with the research team, designers and the community to come up with a prototype that's going to meet those needs that we can then go on and test. So in doing that, we have hui and whono with our community groups have been central to our research project. And we, before we even started thinking about mHealth, what solutions would be, had to work out what health meant to our communities. Did they have the same viewpoint as we did? And Rangi Marie, being a very creative person, brought us a lot of interesting creative tools to tease this information out from the community that I think was much more interesting than the conventional focus group or semi-quantitative questionnairing phase that we have often done in our sorts of research. So got people building things and it raised conversations. What did we find about what health and wellbeing meant to our communities on the basis of this work? Well, for Maori and Pacific, we did a parallel process, recognising that we are different and have different viewpoints, but in the end, we actually found fairly similar information. So for Maori, a key theme that came out of our consultation is that health is about maintaining a strong connection with whānau and to place. So our tūranga waiwai, our marae. People want to really be able to connect with their whakapapa. For Pacifica, same sort of thing, health and wellbeing is family-centred, but I guess being an immigrant population, that connection with place was less important in their conversations. But what I also found really interesting from a geeky researcher point of view is that, you learn about these models, Te Whare Tapawhā and the Whono Whale, which are sort of based on Te Whare Tapawhā, which explain Māori health or how Pacific people view health. And, without any sort of prompting, our communities embodied or told us that health for them was about family, it was about connections, it was about mental wellbeing and spiritual health, and actually tinana or physical health came after all of those things were put in place. So they live te whare tapawhara and the whona whale. And some other key themes that came out of that, which we've used, are particularly for Māori, connecting with whānau, and making sure that you connect with whānau right across the generations, that we're not just looking at a single age group is important. They had a strong desire to connect or to strengthen cultural identity, again more so for Māori than for our Pacifica people. Both groups thought that connecting with the environment was important, and also that achieving good health needed to happen within the financial constraints that a lot of our whānau face. And also time. It was the time lady. They certainly mentioned time as a factor as well. These are just some ideas when we went back to them and said, so given your viewpoint of health, how might a mHealth tool look like, and what might it do to help you achieve healthier lifestyles? And these were some, again, using some quite creative techniques. These are some of the things they came up to tell us about the sort of design they might like, which we then integrated into our prototype. And we're in about phase 2 of the prototype, the second iteration, and these are just some sort of screenshots of this mHealth tool that we've developed with a design group, but has taken on board all the conversations and ideation that we've had with our communities. And these are just some of the things that our people and our research team thought would be really useful components in our tool. And then once we complete that process, which I think might happen in the next 6 months, really getting this tool built and worked up, we are then on to looking to see whether it actually works, and that'd be an evaluation phase, a randomised controlled trial of some sort, and we're in the process right now of working out what that's going to look like. So I shall leave it right there because it's very much a work in process. Thank you for listening, and hopefully we have 1 minute for a question if anyone's got one.
Yes, we do. Thank you, Lisa. That was a lovely follow-up to a challenge that was raised last night for those of you that were here at the Sugar Forum last night. But do we have any questions?
From a lady.
No? Mark?
Sure. I was just wondering whether you had any comment on it's kind of related to mHealth, and that there are some other tools that are available in that sort of space. And maybe one of the other things that needs to be on those slides is availability. Because, for example, there's a continuous glucose monitoring tool that you can get and use a smartphone to actually just wave it over it and see what your blood sugar level is. But it's only available in Australia.
Yeah.
You can buy it here, but you have to pretend that you live in Australia.
It's a bridge too far.
Well, it didn't come up in our focus groups with our communities, but the Nihi group from Auckland are the real experts in mHealth here, and I'm sure they're looking at all sorts of projects around those sorts of ideas. Actually, this project sort of started from an idea of a text-based service, because that's been quite successful in tobacco cessation programs. The research with the groups, I think, indicated that having just simple text sent to people was preferable than having to go into an application. So that's what we had in the backs of our minds. But actually our community seemed to really want an app. But this app process, hopefully we will build in some sort of text-based messaging as sort of notifications within our tools, so that we can build on or use a technique that we know is likely to be very successful anyway. So maybe in the next phase, those real magical things, but it's fast-moving field, so who knows what will be the next year. Was that a hand up?
I think Fran.
Lisa, thank you very much. It's great co-design process. Can you just tell us what you're thinking the mHealth app will do? Is it for health promotion, or is it for biometric monitoring, or what people wanting from it?
The people are wanting a tool that supports them connecting with their families and whānau to enjoy healthy lifestyles together. So it's a tool where there will be enable them to interact with social media, connect with different friends, set challenges for each other around physical activities. So perhaps, work towards walking up Mount Eden, and they'll be able to monitor their progress, count their steps, that sort of thing, get rewards, tickies, badges and things like that for achieving their goals. And then also we're looking at integrating some dietary information that's culturally relevant, hopefully embedding some of the excellent work Toi Tangata has produced over the years, and also bringing in some cultural elements there, because that was very important to our whānau. So we're thinking about karakia that people could say prior to an activity, or whakatauki that might support those activities as well. So we'll see how it goes.
Kia ora, thank you, Lisa. I'm sure Lisa would be happy to talk to people in the lunch hour